As a brain doctor, I have seen hundreds of patients walk into my office with memory loss, confusion, or sudden weakness, not realizing that the real cause wasn't just aging, it was the very medications they were taking every single day. And today, I need to give you a shocking truth. 9 of the most commonly prescribed or purchased medications for seniors can silently increase your risk of stroke, sometimes overnight. These are drugs you may already have sitting on your nightstand or in your bathroom cabinet right now. What shocked me most as a doctor is that many of these medications are given casually, without patients ever being told about the brain dangers they carry. If you are over 60, you need to know this information, because one pill could be the difference between waking up tomorrow feeling healthy or not waking up the same at all. So before we start, I want you to do 2 quick things. Number 1, subscribe to this channel right now, because I'm here to uncover the truths about senior health that can add years of life to your brain and body. Number 2, comment below with this phrase, "I'm protecting my brain today." By writing that down, you're making a public commitment to your health, and you're encouraging other seniors in our community to take control of their medications too. Now, let's break this down carefully, because every single medication on this list is very common, but carries hidden dangers. Medication number 1, antihistamines. Most people think of them as harmless allergy pills. You sneeze, you itch, you can't sleep, so you grab diphenhydramine or loratadine. I had one 72-year-old patient who told me he couldn't sleep without his nightly allergy pill. What he didn't know is that antihistamines can thicken the blood, slow circulation, and even affect heart rhythms. In seniors, who already have slower metabolism and narrower blood vessels, this extra strain raises clot risk. Imagine blood traveling through a narrowed pipe. Now make that blood a little thicker and slower. That's how strokes form. Seniors often see them as mild drugs, but when you combine them with dehydration or another medication, the risk can multiply overnight. Medication number 2, antidepressants. Specifically SSRIs and SNRIs, which are given to millions of seniors. Depression is serious and must be treated, but the catch is that many antidepressants reduce platelets in the blood, making bleeding in the brain more likely, especially if you're also taking aspirin or blood thinners. I recall a patient in her late 60s who was on both an antidepressant and warfarin. She had no idea that the combination doubled her stroke risk. Doctors often prescribe these medications without explaining the compounding dangers. And here's something most seniors don't know. Low sodium levels, another side effect of some antidepressants, can actually trigger brain swelling and seizures, adding yet another risk layer. Medication number 3, antipsychotics. They're often prescribed for seniors struggling with dementia symptoms, agitation, or severe sleep issues. Drugs like risperidone or olanzapine may calm the mind temporarily, but they can also constrict blood vessels and trigger abnormal heart rhythms. Multiple studies have shown that seniors on antipsychotics face almost double the risk of stroke compared to seniors not on them. In my practice, I've seen seniors decline faster, not because of their dementia, but because the drugs meant to calm them down were actually harming their brain circulation. These are medications that should only be used in the most extreme cases, yet they're often handed out for convenience. Medication number 4, NSAIDs, or nonsteroidal anti-inflammatory drugs. These include ibuprofen, naproxen, and other pain relievers you can pick up at any pharmacy. Here's the danger. NSAIDs cause fluid retention and raise blood pressure, both of which stress the arteries. Seniors already have stiffer blood vessels, so when the pressure spikes, those weakened arteries are more likely to rupture or clot. I once had a 74-year-old patient who took ibuprofen every single day for knee pain. He didn't realize that this daily habit was pushing his blood pressure 20 points higher, and within a year, he suffered a major stroke. Pain relief is important, But without guidance, NSAIDs can do more harm than good. Medication number 5. Proton pump inhibitors, or PPIs. Many seniors rely on these for acid reflux, omeprazole, pantoprazole, lansoprazole. They're marketed as safe for long-term use. But here's the truth. Long-term PPIs lower magnesium levels, which is critical for healthy blood vessel function. Low magnesium leads to stiff arteries, higher clotting, and greater stroke risk. Some studies even link PPI use to dementia and kidney disease. I had an 80-year-old patient who'd been on PPIs for over 10 years. When we tested her, her magnesium was dangerously low, and her arteries showed early hardening. Once we adjusted her treatment, her blood pressure and vascular health improved dramatically. The problem isn't short-term use. It's that seniors stay on these drugs for years without reevaluation. Medication number 6. Sleeping pills and sedatives, especially benzodiazepines. Drugs like lorazepam, diazepam, or temazepam may feel like a relief when you can't sleep, but they alter brain activity in dangerous ways. They lower blood pressure too suddenly, cause dizziness, and make you prone to falls. One bad fall in your 70s can cause a brain bleed that is just as deadly as a stroke. Beyond that, they slow the natural circulation cycles in the brain, which means clots form more easily overnight. Sleep is important, but these pills can be a silent brain killer. I've had patients come in thinking their memory loss was early Alzheimer's, when in reality, it was long-term sedative use damaging their brain circulation. Medication number 7. Decongestants. Seniors often reach for over-the-counter cold medicines that contain pseudoephedrine or phenylephrine. These drugs are dangerous because they rapidly spike blood pressure. For a younger person, this might not cause immediate harm. But for seniors, with aging arteries that can't expand easily, a sudden surge can lead to vessel rupture or clotting. I once treated a man in his late 60s who came in with a stroke after taking just a cold pill for 3 days in a row. He never suspected that a simple remedy could cause such catastrophic damage. Medication number 8. Hormone replacement therapies. For women, estrogen increases blood clotting, and for men, testosterone thickens the blood. At younger ages, the body balances this risk better. But in seniors, especially those with heart disease, diabetes, or high blood pressure, these hormones can be the trigger for a sudden clot. Many seniors stay on hormone therapy for bone strength or energy, not realizing the stroke danger increases dramatically with age. Finally, medication number 9. Blood thinners. This one surprises people most. Warfarin, apixaban, rivaroxaban, these are prescribed to prevent strokes by stopping clots. But when not closely monitored, they can cause the opposite, brain bleeds that are just as deadly as strokes caused by clots. The problem is balance. Seniors taking blood thinners need frequent checkups, blood tests, and dose adjustments. Without this, the protection turns into a silent threat. I've had patients who thought they were safe because they were on blood thinners, but when we checked their blood levels, they were actually at severe risk for brain hemorrhage. Now, let's pause for a moment. You might be feeling worried after hearing all of this. And I want to be clear, I am not telling you to stop your medication suddenly. That could be even more dangerous. What I am urging you to do is to make a list of every medication you take, prescription and over-the-counter, and take that list to your doctor. Ask 3 very specific questions. Does this increase my stroke risk? Do I still need this medication at my age? Are there safer alternatives for me? Those 3 questions can literally save your life. Almost every senior I meet is taking at least 1, 2, or sometimes 5 of these medications together. And what most people don't realize is that the risk doesn't just add, it multiplies. 2 or 3 medications can interact in ways that triple the chance of a stroke. This is why awareness is everything. Before I close, let me remind you, this video is not about fear, it's about empowerment. Once you know the risks, you can take action. You can review your medications, you can ask your doctor for alternatives, and you can make choices that protect your brain. So here's what I want you to do right now. If you haven't already, subscribe to this channel and turn on the bell icon, because I will keep bringing you the life-saving health information that doctors often don't explain in detail. And please, drop a comment below with the words, "I'm checking my medications today." Not only will this help you commit to action, but it will inspire others to do the same. Your comment could be the reason another senior avoids a stroke. Remember, knowledge is power, but action saves lives. These 9 medications do not have to be silent killers. With awareness, monitoring, and smart choices, you can protect your brain, lower your stroke risk, and live many more healthy years. Stay strong, stay proactive, and I'll see you in the next video.